Fact Sheet: Aging in Hong Kong. According to the Census and Statistics Department, the total population of Hong Kong is projected to reach a peak of 8.22 million in 2043 and decline to 7.72 million by 2066. The number of elderly persons will increase from 1.16 million in 2016 to 2.37 million in 2036. In 2066, the number of elderly persons is projected to reach 2.59 million. Specifically, the percentage of the elderly population as a subgroup is expected to rise from 17% in 2016 to 31% in 2036 and 37% in 2066. It is also worth noting that the elderly population will remain at over 2.3 million for at least 30 years. Concept of healthy aging. In order to tackle the acute problem of population aging, World Health Organization reaffirmed the healthy aging concept in the World Report on Aging and Health published in 2015. In this report, WHO recommends countries to provide adequate assistance to older adults, enabling people to be and do what they value throughout their lives. Healthy aging is the process of developing and maintaining the functional ability that enables well-being and to do what everyone values. Functional ability is made up of an individual's intrinsic capacity, which is the physical and mental capacity, relevant environmental characteristics such as home and society, and their interactions. When older adults experience decreased intrinsic capacity and gradual loss of functional ability, healthy aging is affected. Under this situation, however, a well-planned environment could compensate for the loss of intrinsic capacity and hence functional abilities. Prioritized strategies. A good way to handle the aging population is adapting the healthy aging concept at all levels of society, from policy implementation to our own thinking. To foster healthy aging, the World Health Organization proposes 5 prioritized strategies. They include: first, commit to action. Second, align health systems to the needs of older populations. Third, develop age-friendly environments. Fourth, strengthen long-term care. And fifth, improve measurement, monitoring, and research. Commit to action. This focuses on political and operational platforms, urging governments and the civic sector to establish a policy framework towards healthy aging, strengthening the capacity to formulate related policies and combat ageism. To this end, the Hong Kong government sets guidelines to age-related policies, from objectives of sense of belonging, sense of security, and sense of worthiness in 1997 to the updated guidelines of aging in place as the core, institutional care as backup. The recent Elderly Service Program Plan, with the help of Department of Social Work and Social Administration at Hong Kong University, envisioned 10 principles in guiding elderly services policies, including active and productive aging, age-friendliness, and age in place. Align health systems to the needs of older populations. Health systems should transform to enhance older adults' intrinsic capacities and thereby functional abilities, ensure affordable access to care, and develop a sustainable and appropriately trained health workforce. To this end, Hospital Authority issued a Strategic Service Framework for Elderly in 2012, with guiding principles to enhance well-being of older adults and to contribute to healthy aging by raising standards of healthcare. This framework introduced for the first time a focus on wellness, patients' transitions from hospital to communities, and close collaboration with non-hospital related partners. Moreover, in 2015, social welfare departments navigation scheme for young persons in care services provided employment and training for young people who are interested in working in either elderly care or rehabilitation services. Develop age-friendly environments. Here we focus on society, removing barriers that hinder older adults' autonomy and engagement, and promote multi-sectoral actions. To this end, the Hong Kong government launched multiple strategies in 2012 to help change the environment, including Public Transfer Fare Concession Scheme, also known as the $2 Scheme, and the Universal Accessibility Program, which further enhanced accessibility to help older adults to move around with greater ease. Most recently in 2018, the Employment Program for the Elderly and Middle-Aged assisting older adults to integrate into workplaces. Strengthen long-term care. Long-term care should be sustainable and should not only be focused on the formal, employed workforce because informal caregivers are just as vital. A person-centered integrated care should be promoted in the process. To this end, the mentioned aging in place as the core, institutional care as backup approach benefited older adults to age in place in the comfort of their homes. Improve measurement, monitoring, and research. Finally, healthy aging requires constant monitoring to ensure its effectiveness, and therefore ways to measure, analyze, and describe healthy aging should be agreed upon by stakeholders. It is also worthwhile to strengthen research and innovation to build evidence of healthy aging. To this end, since the year 2000, the Social Welfare Department has implemented the Standardized Care Need Assessment Mechanism for Elderly Services, deploying the internationally recognized assessment tool, Minimum Data Set Home Care, to ascertain the care needs of older adults, matching them with appropriate services. Also, the Innovation and Technology Fund supports the development of older adult-friendly technological products. Most recently in 2017, Community Care Fund supported the pilot scheme on home care and support for elderly persons with mild impairment, provided home care to low-income older adults with mild impairments. We believe in equipping our students with aging literacy, and the Campus project is an important start in advocating measurement, monitoring, and infusing aging into education approaches, starting with our campus and extending to other platforms in the future. Geron Infusion Education, Campus. Geron Infusion Education, Campus Aging Mix Project for university students, aims to promote age-friendliness at the University of Hong Kong through achieving the following 4 objectives. First, fostering Geron Infusion scholarly leaders. Second, nurturing geriatric and gerontology knowledge in teaching and learning. Third, promoting the integration of geriatric and gerontology knowledge into curriculum. And fourth, enhancing the institutional capacity of Hong Kong U on aging infusion education. We believe in achieving the above 4 objectives. The Campus project would play a significant role in promoting healthy aging among the undergraduate students, the academic communities, the university, and the community as a whole.